Post-surgical pain and complications, such as swelling, is one of the most common concerns for patients interested in receiving implant therapy. Local anesthesia, in most cases, is enough to ensure that no discomfort is felt during implant placement. But what happens after the patients leave the dental chair? In a recent study in our clinic, we asked the patients to keep a healing diary for 2 weeks after the implant surgery. It revealed that, for the majority of cases, implant surgery was well tolerated. Minor discomfort, such as swelling and pain, was transitory, limited mainly to the first 3 days post-operation, and could be well controlled with simple over-the-counter drug NSAID. When comparing with other routine dental alveolar surgeries, for the patients getting more straightforward implant surgeries, discomfort felt during healing was similar to that of simple tooth extraction. In the same graph, you can see that the level of pain increased when guided bone regeneration was used in conjunction with implant surgery, something that might be attributed to the higher invasiveness and the longer duration of the procedure. On a daily basis, patients usually feel the strongest pain at 24 hours after surgery. Our data find that only half of the patients needed painkillers on the first day, while only 1 out of 4 patients still need to take painkillers on the 4th day. Swelling was mainly observed when guided bone regeneration was applied together with the implant placement, and it appeared to peak during the 2nd day after surgery, and then steadily subside. Minor swelling of that type is a natural part of the healing and not a complication. Today, we perceive this type of swelling as an essential part of the healing response, as the body mobilizes essential resources for the repair of the operated area, and there is no need to take any action or medication to prevent it. Communicating these factors prior to the surgery will help patients to better prepare for the healing of the post-surgical period. Bruising and bleeding occurred to a much less degree. When observed, bleeding disappeared completely on the 3rd day after all types of surgeries. Transalveolar extraction, here implying wisdom tooth extraction, showed the most frequent bleeding. But still, it was only limited in 1st and 2nd day. Bruising appeared more frequently in implant surgery with GBR than other types of surgery. But again, it occurred to a small amount of the cases. Using such data, and in particularly when we can relate them with a procedure the patient has already been through, like for example, an extraction, can help the patients to better understand and prepare for the surgical intervention. It will also allow us to discover what is unique and meaningful to each individual and identify possible misconceptions.